I think people don't even realize that they're holding all this tension, or maybe they're just thinking, like, from traditional medicine standpoint, like, oh, I had 3 babies, it's normal to leak urine, or I'm getting older, it's normal to have, you know, dry vagina, which we're going to talk about in a minute.
Yeah.
Welcome back.
Today we have a very fun episode I'm really excited about on Unfilter It
with
Lindsey
and China.
All right.
We have my very good friend. I'm so thankful that she's here, Dr. Emily Bessemer.
Hi, everybody.
Round of applause. Dr. Emily is a very experienced, highly specialized pelvic floor therapist in our community, and she's here to talk about all of the things she does. What makes Emily so special is not only is she very experienced and very gracious and passionate about what she does, she also kind of ties in a lot of magical properties to her treatments. She works in the energy field realm. She does a lot of things to make her patients feel at home and comfortable. So thank you so much, Dr. Emily, for coming.
Yes, thank you for coming.
Thanks for having me, guys.
Yes.
So first, I guess, just tell us a little bit of your background, how you got into specialized physical therapy, and why did you choose pelvic floor?
Okay, so my story is like a little convoluted, so I'm going to try and tailor it down to this time period together. But I got into physical therapy because I knew I wanted to do something in the medical field. I wanted to work with patients. I wanted to be one-on-one. I wanted to work on muscular groups. And I had never been to a physical therapist before getting into PT school, so I got there and was wildly surprised by what they did. I was in exercise and wellness, and then by the time I got to my 3rd year in PT school, there was one day on women's health. And in that one singular day, they offhandedly mentioned you could treat pelvic pain, which is something I personally had suffered with forever since I was small. And when I learned that, I wanted to learn more. And so you had to go to Boston to learn more classes. I went to Boston, I got treated. I, knock on wood, have been better ever since, and I knew this was what I was supposed to do and get into. So I have been on a mission to do that for now over a decade. I've been treating in practice, and I love everything about it. It's just awesome to be able to help people feel better and work in that world.
So what was cool about meeting Dr. Emily was we met in yoga training.
Yeah.
And so I kind of went on this deep dive spiritually into the yoga world and just needed something for my own practice. And like we fell in love, and we were just like, hey, I'm in medicine. You're in medicine? What do you mean? You're a doctor? What do you do? And so then we were talking about it, and pelvic floor therapy was something that I knew nothing about. Even with years of experience working in trauma in the hospital, I had no clue. So Emily like really broadened my horizons, and I realized that it was something that is definitely lacking in our community.
100%.
Especially in surgery, which we'll touch on later. So tell us, Emily, what is pelvic floor therapy?
So pelvic floor therapy, you will meet my lovely pelvis Penelope today.
Love that.
Penelope wants to show you that all the pelvic floor muscles are what live between our sit bones. So it supports our low back, it supports our sacrum, our pubic bone, our sit bones, and it aids in sexual health. So it provides blood flow, musculature, movement to the entire muscle system that holds up our entire body.
Sounds pretty important.
Yeah, most of our system has bones and structures that can anchor to it to protect it, but it ends with this muscle group that helps to keep everything in place where we want it to be. And so it's amazing that we don't know more information, because prenatally and postpartum wise, we have so much information about birth and what to do now, but we don't talk about the muscles that hold everything where they're supposed to be. So this is
and
what
sometimes cause a lot of the symptoms during both phases.
Absolutely.
And after. Yeah.
Yeah.
Cool.
All of our little friends here.
Awesome. I love that. So what are some of the typical treatments or complaints that you see, like, that patients come to you?
So I primarily specialize in pelvic pain. So right now I see dyspareunia, which means pain with intercourse, and vulvodynia, which is like vaginal discomfort and pain. It can be like irritating, burning nerve symptoms, which I'm sure we'll get into more of that later. But there's also prenatal therapy to prep for birth, postpartum for after having going through childbirth, both for C-section and vaginal delivery. We see all sorts of spectrums of sexual dysfunction, menstrual cycle pain, endometriosis, all that kind of good stuff that we work on.
So are you getting a lot of referrals from like OBGYNs? Like what is how do people know?
How do they
Honestly, the internet has been great for pelvic floor therapy. I get most of my referrals from word of mouth and like social media at this point. So the more information that gets out there, the more people who learn, they kind of self-refer. And then they go back and educate their doctors on what we've done. And then I get referrals from the doctors.
From that.
So,
That's amazing.
yeah, that's primarily where my referrals come from.
Cool. So lots of pregnant people that you work with. And
Yeah.
what are some of I know your practice is bounding and very busy. So like what are some of the other services that you offer?
Yeah, so at my office space, I offer craniosacral, Reiki, and private yoga, which is all just part of the same spectrum of care. It's just once we're out of pain, now what do we do with our bodies? But within the facility, there's also social work and sound baths and breath work and all of the counseling services that people might require and all of that too. So it's been a beautiful, flourishing integration of all the things.
I love that.
Yeah.
Yeah, because it's a one-stop shop for
Yeah.
everybody.
Well, and
That's
if you've
really
been
great.
suffering through your life with pain with intercourse, like you're gonna need to talk to somebody about it. Whether
Absolutely.
it's me or anyone else, we want to make sure that people are taken care of and listened to. And sometimes, I'm sure in your practice too, you might be the first person someone's like confiding information in, and now you need to have a good referral that you can trust to send them to continue to talk about it. So,
For sure.
Yeah, absolutely.
Yeah. Yeah.
So energetically speaking, Emily, what are some of the energy things that you find connected to the pelvis?
So our like structural system is one thing. So we anatomically have a pelvis and a pelvic floor and legs and feet and all the good stuff you already know about. But energetically, we have a root chakra and a sacral chakra in this same component. So when we talk about womb space, like you'll hear you'll see on the internet a lot of like womb space and magical creations and what are we manifesting from, we're talking about the sacral chakra. So our energetic system, when we're birthing new life into reality, as well as when we're birthing projects into reality, can cause tension, like literally fascially in our system too. Our stress response, and I could go on a tangent forever, so stop me if I get too
Go. We want the tangent. We're here. I'm coming to your office after this. I'll be following you back.
Our stress response starts with our tailbone. So if you think about a puppy, right, and they get scared, they tuck their tail underneath their legs.
Yep.
Oh, yeah.
So our tailbone lives in the musculature of our pelvic floor. You can see it here. And so when we're tucking our tail under, we're also clenching our jaw. And so the dysfunctions from top to bottom.
She's got me pegged.
Yeah, that's China all day, every day.
From all of those things. So we do a bunch of craniosacral energy work is things that work on the head, the neck, the jaw to help relax that system because TMJ and pelvic floor dysfunction run hand in hand, and we work on all of the gambit of all of that. And then when we talk about our root chakra, like if you also check social media, I'm sure you can look it up, but if you look at your root chakra, they talk about feeling grounded. And if your system is feeling out of whack, you're having pain, you don't feel safe in your body, there's a lot of energy components to feeling grounded and feeling secure. And so I do some essential oil techniques, different aroma acupoints, and craniosacral to help kind of resolve some of those feelings to let a person feel safe in their body.
So here's a question that comes up a lot, especially when you're talking to or seeking out these types of treatments. As far as energy work goes, what is the difference between craniosacral treatments versus Reiki, et cetera, et cetera?
Yeah. So craniosacral stresses on the diaphragms of our system. So we have a pelvic diaphragm, like the diaphragm that diaphragm, a respiratory diaphragm, and so you're looking at aligning some of the fascial restrictions around the diaphragms, and that can get into more complex educational components that we can go into too. But the difference between that and something like Reiki is a hands-off technique. You can do it with hands-on or just like working in the energy field of someone aurically. And that can change based on what someone's comfortable with. Like someone might not be comfortable with me putting my hands on their belly, so we can work on energies externally as they get comfortable with me. So those are kind of some of the differences. There's also just a blanket term of like energy healing. Like what is energy healing? And honestly, I think we're all doing it. As you work on making someone feel more empowered in their bodies and themselves and how they appear, that is energy work all on its own. Like you really can make someone have a totally different viewpoint and type of life by helping them feel safe and secure and comfortable in their bodies. All of it is energy work.
I noticed that. Do you ever notice your patient that you get your treatment, they're coming in to follow up and they're like a whole different person now and confident in everything? I see it all the time. Happen all the time. And they're like, I'm just happier. And I could have done like the littlest tiny thing. I'm not meaning like they're doing something crazy, but they're just
like
more confident.
When
Yeah,
we're doing
it's great.
like full face stuff and we're poking them a bunch of times and then they start crying over something that's like not related. And like I always joke and say like, oh, we just released some energy. And it's true.
But you really are.
Is.
You really are. I mean, think about the confidence level that changes as someone can feel more safe. Even if someone comes to you and you're like, oh no, you don't need that service because you're already perfect just with what's going on, that changes the way that they view themselves. Like we're instantly changing some of the energetics of someone's life. And so I think all of it is energy work. However you make people feel, that changes how they move in the world. And then that changes their quality of life. Really.
So what's so interesting of what you just mentioned was how you said like TMJ and jaw pain can also tie into your pelvic floor, which is something like I've seen you for because, and I didn't even realize you're like, oh, do you have tension in your jaw because your hip is tight? I'm like, I do actually. So like that's something that I think people don't even realize that they're holding all this tension, or maybe they're just thinking like from traditional medicine standpoint, like, oh, I had 3 babies, it's normal to leak urine, or I'm getting older, it's normal to have, you know, dry vagina, which we're going to talk about in a minute. So I think like getting more information out there, like no, it's not normal. No, you don't have to live with urinating yourself.
That's what I say. Like I think social media, as much as like sometimes I have a really hard time with posting on Instagram regularly and keeping up with the things.
Same.
As much as that is a thing, it is also it's been so important for people to learn about their bodies. They didn't even know that they could fix this one thing that's been going on, or that it wasn't normal because their mom, their sister, their aunt have all had the same things happen, but it doesn't have to be that way. And there's like little easy fixes for things that don't take much time even. So.
And I think now too, maybe with the changing times, people are, at least in my experience, becoming a little more comfortable in talking about the things that they're experiencing, or at least because of, like you said, social media education, they're a little bit more apt to ask the questions like, hey, I have this going on, what can be done about it?
I think there's just so much knowledge online that people are like, maybe this isn't right. Maybe I don't need to live like this. And definitely people have more of a voice today for themselves than ever before. Sometimes bad, but it's okay. But I think that you're right. And even for us, just the internet or social media is huge too.
I mean, the feminism movement has come with a whole lot of things. And part of that is that we feel comfortable talking about our bodies. And how cool, like now we can really feel safe and secure talking to one another about what's going on in our system. And then the minute you start saying like, oh, you know, I've had pain with intercourse, someone else can be like, oh yeah, that's happened to me too. That's not normal. Like that's not something I need to deal with. This is like, as I get older, this isn't something that has to happen. All that stuff is things that we talk about now with one another, our friends and otherwise.
Yeah, sure.
Yeah, definitely.
So speaking of an intercourse, one of my favorite things to talk about. So Emily and I were the anatomy geeks of our yoga program, right?
Sure.
Like everyone was like, Dr. Emily, China, what does this bone do or whatever? So we would always like kind of commiserate in that realm. So I think that the most important topic when it comes to sexual health is that the stark fact is that most people don't even know their own anatomy.
For sure.
So Emily, tell us.
Give us the lowdown.
Anatomy.
Okay, so the female anatomy is highlighted on this model. So we're going to start here. That the clitoris is in yellow. We have the urethral opening underneath, and then the vaginal opening under that, and then the anal sphincter and rectal opening. So this is the funding.
I feel like most people
in order.
Most people in my realm or world understand where their anus is. They know where their vagina is because that's where they put their tampons.
And that's it.
And that's it.
Yeah.
Like I've had some people think that they pee out of their vagina hole.
Yeah, they do. They do.
Not
think
the
that.
case. There is a separate hole that
there
you
is a hole
pee
for
out
that.
of.
That is what it is.
Yep.
And then when we talk about, orgasms and sexual pleasure, that's coming from a whole other system.
A whole other structure that lives underneath your pubic mound that ends with like a very small little piece of it that you can like palpate and touch, but it's actually a lot deeper and like underneath.
So here's what I found fascinating. Emily, did you know when the structure of the clitoris was actually found?
Oh my gosh, you told me
Like in
this
what
at
year
some
you
point,
mean?
but I can't remember.
What year?
Last year. No.
Ready for this? Are you
Really
ready for
recent.
this?
It was like
2005.
What?
So
2005.
anatomy books,
Come on.
anatomy books prior to 2005 showed the structure of the clitoris as this like little pea-sized structure in the pelvis. It was not discovered that it was an entire structure until 2005. That's
kind of
sad.
insane.
So
That's
sad.
insane.
So developmentally, when we're embryos and we're developing, the erectile tissue of the penis and testicles is very similar to the structure in a female as it's developing. And then as the hormones get released, it kind of goes off into either male
Chooses one
or
the
female,
other. Yep.
or a combination of the two, which can be a whole other episode.
Yeah, we could get into that for a while.
The clitoris is a erogenous zone in the pelvis, so it is responsible in one part for female pleasure with intercourse or sexual experiences. It is a larger structure than you can see, and I wish I brought my golden clitoris because Emily got me one to show. It's very similar.
Get yourself a pelvic floor friend.
It's very similar in looks to the penis, if you will, on a smaller scale. So the clitoris itself is erectile tissue. You need blood flow to get there for arousal. It kind of goes into and underneath the labia, so that's why there is some sexual pleasure in those areas as well. And then the orgasm will be, your arousal will build into a energy release, which is a orgasm, but then causes contractions of the pelvic floor.
Yes. And so part of when we work on pelvic floor dysfunctions that are causing like low libido or lack of orgasm, which is something we can work on in pelvic floor therapy, is because there's less blood flow to the musculature. And also the activation of the muscles isn't as strong as it could be or should be. And so when you go to get that release, people don't get to the final climax because they're not getting the rhythmic contractions of the musculature. Yeah. Wow. So interesting.
So what is the blend here, and why are we talking about this today? Is because that there are treatments for, and I see this a lot, very common patient, what's the word I'm looking for? Population is the postpartum period. So women who have had babies in any period leading up to after the birth of their child or even before can experience some dysfunction in this area. And a lot of complaints are, I don't have the ability for arousal, I don't feel aroused, and I can't climax. I have met some women who have never climaxed, and they're in their 40s, 50s plus. If one of the intake questions that I ask for sexual health is like, have you experienced an orgasm? And if so, like in what manner? We do kind of go a deep dive into very intimate questions. And if your response to me is like, well, I'm not sure, then it's no. Right?
Yeah.
Yeah, you would know.
You kind of know.
Something you know.
You should know. I mean, you should know. But then there's
know.
and there's a lot of things, I'm sure you can attest to this, that kind of go into female arousal. Is like there's an emotional component, there's an energy component, there's a physical component, and then there's like, your blood flow, nerve endings, all of that.
Yeah.
So one of the treatments that we offer is the O shot, which is an injection of PRP or PRF into the areas that will help you develop blood flow, engorgement, and help with regeneration of some of the tissues. So you can lose some of the integrity of these structures due to childbirth, right? Because the weight of the baby, the stretching out of these structures.
Oh, yeah.
not everything goes back to normal, or where
what
it
is
was
normal
to be.
before,
Yeah.
what it was before. So that can contribute to some changes. So we draw your blood, we spin it down, and we inject the healing properties of those components of your blood into certain areas to help with blood flow and nerve regeneration and so forth. So that can help with not only arousal, but vaginal lubrication. It could also help with, incontinence, which is, I know, something that you work with a lot too. And then the second part of that, or entwined in that, is your pelvic floor therapy. So touch upon that for us.
Which part?
Tell us
all of the things. So pelvic floor physical therapy, when it comes to, we'll just use the reference of postpartum because that's what we're talking about right now. But when it comes to postpartum period and you're trying to encourage more blood flow, more lubrication of tissue, just overall libido, would involve like an internal assessment and work. So if someone is doing pelvic floor therapy and they're not doing an internal assessment of your musculature, you're not having pelvic floor therapy. But which is just good to know.
Yeah.
And there are great things you can do without having an internal work if you're someone who is not interested in that. But there are some people who sometimes will say they're doing pelvic floor therapy. They are not.
All right.
Doing a musculature assessment of the pelvic floor involves like massaging and working on the muscles here, just like we would your upper trap. The structure of the pelvic bowl is very similar to your upper trap. So it's literally the same musculature of the upper body that sits on the bottom. So when you're getting stress responses that you need to have massage work done on this upper shoulder area, it's also the same for the pelvic bowl. So you're trying to elongate and allow release to any tight muscles or trigger points within the fascial lining. That helps with better blood flow, it helps with better lubrication, and it also just brings awareness to the pelvic bowl because honestly, postpartum childbirth, as well as just like being a woman in the modern day, can tend to get us to disassociate from our pelvic bowl too. So just bringing your intention and awareness back into the pelvis, the pelvic floor, and feeling, again, safe in your vagina. I hate to like keep using the word safe, but that is kind of the big thing. And then when it comes to libido, particularly for new moms, it requires 45 minutes for a woman to feel sexually aroused. So if you don't have 45 minutes of not being touched by your child and also not feeding them and also, feeling sexually empowered in your body and not feel like that all plays a role in how your libido is responding. And so some of that too can be because we just don't have time. We're meant to be in a structured community that has help and friends and aunts and moms all around to like help take care of your child with you. And when you're the primary caregiver as well as working a full-time job and doing all the things, sometimes libido gets low purely because you don't have time. So giving yourself the opportunity to read something that you feel really good about reading or watch a show or get into your body, put on nice clothes, get a facial, like things that like seem to be not related are completely related to how you can feel sexually empowered and boosting libido too.
And then also the psychology of arousal is a whole other component, but something that you can feel like you're communicating well with your partner and able to not also be the caretaker of your partner is huge for arousal, especially postpartum.
Yes.
Because a lot of the times as a new mom, you have a new baby you're taking care of, and then you're also kind of taking care of everything, even though you might have a supportive partner, you sometimes just feel like you're taking care of everything.
Yes.
So to be able to communicate and have that support system and feel supported and maybe like are able to take the time to even
I feel like it's just the mental exhaustion.
Mental exhaustion.
We're always thinking weeks ahead, and especially with the newborn, forget it. But it's always like we're always planning what's next, what do we need. I think it's that part, even if you're not physically doing what needs to be done and you have a great partner, but you're still thinking to the next week, the next day.
So I try to encourage, particularly in the postpartum period, a little bit of gentle love and care for yourself and for your partner and for you, because you're navigating a whole new person. Like you yourself have become a whole new person in the process of childbirth, and I have chills saying it. But
you grew a human. That's
like
huge.
A reality, and you've birthed them in like you grew a whole person.
A whole person.
So giving yourself a little bit of grace during that time too is also like welcomed, and education that like you do need time. You need time to not be touched out all the time. So so some of that as well. And then the same components that you were just talking about also are in perimenopause. So the nerve endings, the blood flow, the libido, all of that is something in perimenopause when we'll get what's called vaginal atrophy, or a thinning of the vaginal canal, can be worked on with pelvic floor therapy in the same way, bringing new blood flow, bringing awareness, bringing yourself into your body, particularly if you're someone who never had therapies after giving birth, and now you're at a point in your life where you're like, wow, I'm feeling like I'm going through some changes, I'm not sure, I don't know, and like getting some integration into your body again can feel really nice too.
Cool. So also, let's kind of dive into the surgical world a little bit. And I know you're going to go into all the nerve stuff, but I just did want to touch into like C-section scars and just pelvic scars in general from either childbirth or abdominal surgeries, abdominoplasties. Tell us some of the treatments that you could offer for scars.
So I, in my facility, do several different things for abdominal wall health in general. So there's scar work that involves like working on laparoscopic surgical scars, which can be tender and restrictive, things for C-section recovery where things get a little bound down or uncomfortable, in which case we do fascial work, like we do hands-on fascial work and releases. I also have a specialty in something called Mayan abdominal massage, which is a traditional technique of realigning the uterus, the viscera, and the fascial lines of the abdominal wall to help realign some structures for if you're having discomfort. And for a lot of people, they'll come in talking to me about diastasis. That's the big one that comes right now. And that comes because the internet is crazy about it. They're like, nuts. So someone found out somewhere that everybody gets it, and they're like, let's talk about it more because we can. But it is a very common, very specific occurrence where the abdominal wall will separate a little bit to a lot of it, in which case sometimes surgery is the recommended move because there's only so much you can do when you start herniating.
Right.
But there's also a lot of stuff you can do fascially with hands-on work and exercises. Movement is medicine, and if we can get people moving and moving their bodies healthy and safely, then that can really help align some of the structures just for function again.
Right.
But that's the big one too that we talk about a lot in pelvic floor therapy right now, is that abdominal wall separation too.
And that can happen in both men and women. It can happen even in women that haven't had children. It's sometimes an age-related issue with the abdominal wall being weakened and then the muscle separating. So what are some of the typical symptoms that maybe someone would have, not realizing that it's a scar tissue thing? Like, you know what I mean?
Well, so it would depend on where they're at in their like life. So is it, are you still having a menstrual cycle? And if post cesarean birth, you have restrictions and feeling tightness, and you're having more pain with cramping, more pain with bleeding, more pain with ovulation. Those things can be one thing. If you're in menopause time frame and you're noticing that you didn't have pain or leakage before, but you are starting to have pain and leakage now, sometimes as the tissue gets less estrogens, when there's a restriction in a scar, it can cause you to have pain and leakage later. So you don't necessarily know right away because you're like, estrogen's lovely. We have a lot of it. It's perfect. We're like moving and flowing and everything's lubricated great. And then you get to a little, like a certain age, anytime over 35, honestly. And then you start to notice like, ooh, when I have intercourse now, my like right hip kind of hurts. Or I tried this new position and now I'm in pain. Like what's happening can be a sign that the scar is like impeding some like elongation of the vagina. So we want to work on scar tissue too to help like kind of mobilize some of that.
Amazing.
Yeah.
Cool, right?
Yeah.
Like stuff you don't even know about.
Yeah. So I feel
we
like
need to be some awareness.
Let's talk about some of the stuff we do.
Yes, so at the Plastic Surgery Center, some of the surgeons started doing pudendal nerve releases years ago. And Dr. Alkwood started it in the practice, and he taught a bunch of other docs, so they're doing it. And a lot of the women that came in were like what you're saying, had no idea they could even, that there's help for this, or there's a cause of this, they're having painful intercourse.
Pudendal neuralgia.
It's bad. We've had people that were like cyclists having it after birth, accidents,
So let's talk about
all kinds of things.
What is pudendal neuralgia?
So there's a nerve, and this model doesn't have nerves, so I'm going to do my best to kind of model it, but it's probably not accurate, but we're gonna try. But there's a nerve that comes from it's a branch off of your sciatic nerve that innervates the entire pelvic floor. So both the vaginal wall, the opening of the vagina, the introitus, and it kind of spider webs like this. So you have this extra nerve endings that come across. And when this is inflamed, it's similar to the idea of having any nerve inflamed. It feels like sharp, hot poker pain, that anything just sitting can make it feel worse. And so the pudendal release helps to kind of allow more movement to happen, same as when you get sciatica down your leg, and people have more experience with that overall. So you'll have numbness in your calf, or you'll have pain down the leg. The pudendal nerve just goes directly to your pelvic floor area. So
and there's also a lot of patients that did have sciatica, and then it was causing their pudendal neuralgia just because everything's connected. So we would release both a lot of the times. So I think that our patients, I'm going to talk to the doctors, and they need to be in line with you. Because they need some help. Maybe they're not surgical candidates. Maybe they're too scared to do surgery. But I think,
or even just sounds
it
like
would be amazing.
It sounds like too that even if you have somebody that has this condition, if they're lined up to have a surgical release, even if they're doing the PT along with it, they're just going to have better results.
The outcomes are better overall. So 100%. When we look at someone who's doing exercise, doing movement of muscle, doing activities, and also having someone that they can text and call and talk to, where they know they have an hour with me in 2 weeks, it tends to result in better outcomes for the patient because they just are already doing things that are helping to move stuff. So that as that nerve feels better, their confidence levels are higher in knowing what they're supposed to do as they're being released from needing surgery procedures. So.
And it's just this overall support that really helps patients.
How about post-surgery? What kind of treatments should someone expect post-surgery?
It totally depends on the person. So I am a big listener to stories. I don't have a specific protocol that I put out with anybody because they could leave surgery and feel 100% better, and then I want them to do whatever movements feel good for them. I am a big believer that movement, no matter what it is that you're doing, it's medicine. And if we can start giving ourselves the intention in our mind that exercise is not just for us to feel like a certain body type or lift something a certain way, it's really a medical thing, then people can feel good. So if they leave surgical procedure and they're like, I feel great, I have no pain, then we go right into learning how to move for their bodies and what they like to do.
Perfect.
If there's someone who comes to me and they're still having some tension or they're having some issues still and happening, we go through a pelvic assessment, and then from there, normally I see people post surgery if they're in the projection of not having pain, maybe 3 or 4 sessions total, but just to give them the confidence in knowing how to stretch and move their own bodies.
What I think is also unique to your practice, and just in knowing you and being a patient in the practice, I know, it's that you not only have the safe space for the medical treatment and the physical therapy, but then you also have these additional programs such as yoga and other movement classes that are safe for the conditions that you treat.
I made those because when I worked in a facility that didn't have that type of option before I opened my own practice, I saw that my patients were too scared to go try and do anything because they've never moved before. They've never moved in a pain-free way, and now they are moving pain-free, so how do we keep it that way without hurting ourselves? And so I created a lot of these programs to help, including a virtual one that's like a little 30 to 45-minute exercise program twice a week that you get, and it just allows people to talk. I'm doing it, I'm teaching it, you're talking to me. When you email, it's me. When you text, it's me. And it makes people feel comfortable just to move and feel safe in their bodies.
Other than just going anywhere else where they don't technically treat pelvic floor.
We sync it with the moon cycle. We add in exercises for strengthening your pelvis. We talk about manifestation and all of that as we move your body too.
So
Love
awesome.
that. Yeah, it's really great what you're doing.
Thank you. Thank you.
What is your favorite treatment overall to do in your practice?
So many.
I mean, clearly she loves everything.
All of them.
I
She loves
clearly
everything.
love all of it. I love it's the continuum of care that I just cannot stress enough. I really love. So I see people who have had infertility and then they get pregnant, and then I see them during pregnancy, and then I get to see them postpartum, and then they see me for energy work, and I just feel so honored and lucky to be able to see them through this evolution and change. Like, people really are evolving, and I think that is my favorite thing, just the continuum that I get to have. And especially since opening my own practice, because we don't, I'm my own entity. I can do all of the things, and I get to keep seeing people for all of the amazing
all
stuff
of
we
life.
get to do.
Yeah, I think that's
and
great.
Emily's being very humble because
I know.
Emily, just to give you a little bit of insight into her growth, Emily worked at a hospital setting doing physical therapy, wasn't extraordinarily happy in what she was doing, and so her friend group would, including me, thank you, I am her friend group, was
am her friend group.
Emily, you have to go out on your own. Like, if you just do it, it will happen.
Yeah.
And, I was fortunate at the time to have space that you were able to come in and get started, get your feet wet a little bit. And then boom, the second I had to sit Emily down fast and be like, Emily, you have outgrown our space. Like, you need your own space now. And she did it. And now it's this huge community of women. And it's just so good to see.
It could make me cry a little. It makes me just number one, I'm so grateful because I don't know without China where I would be. So we're going to just throw that out into the universe. And all
you definitely did it all on your own, but it's just so.
And then just the ability to create community is beautiful. We have lactation consultants, everyone who you could possibly imagine in the same facility. And it's just so great. I mean, I was just doing my totals. So I've been in practice in my own space for 3 years in September. And I've seen over 500 women at the practice. And it's just something I never thought I could say. And I get to integrate energy work and yoga and all the things that I love into this sacred space for people to get better and really feel better. And it's just.
And I can speak to this with probably 100% accuracy. When Emily says 500 people, it's 500 continued people. She has really cultivated a community of people, and she has very high retention rates. So we're just so proud of you.
Yeah, thank you.
So, Dr. Emily, where can people find you if they're looking for consults?
So if you're looking to learn more about the practice in general, Instagram's the place to go. It's at Embodied Physical Therapy, and then through that you can find our website, which is www.embodiedphysicaltherapy.com. And you'll get all of the contact information about how to sign up for classes, how to talk to me, how to learn about what we're doing, and all of the services that we offer there.
And we will link all of your information.
Yes, below. So when you're not being the master of the pelvis, what do you do?
Oh my gosh, I don't even know.
Nothing. That's her whole life.
Any time off.
There's nothing. That's it.
I practice a lot of yoga. I do my own energy work for myself, and I honestly love taking classes. So right now I'm signed up for 3, China knows because that's how we met. I signed up for 3 different programs. I'm taking a medical therapeutic yoga. I'm taking a holistic pelvic care with Tammy Lynn Kent. It's in California. I have all these crazy things going on.
Always learning. That's great.
She really is.
Yeah.
So
she does Pilates. She's
I
an instructor of everything.
Oh.
Well, thank you so much for coming and enlightening.
Wealth of knowledge.
And telling us what you do.
I think our listeners will love it.
Yeah, same. And hopefully we'll have you back one day.
Yeah, anytime. You let me know. I'm here. Maybe if people have questions, they can write in and I'll come back
and we can
answer
have a
them.
Q&A.
I would love that.
Yeah,
We can do a live.
A live. Cool.
All right.
Well, that's a wrap on our next episode of Unfilter
with Lindsey and China. See you then.